Hi, Rosa.
Hi. Well, have a good time.
Thanks for coming.
You're welcome.
Bye.
Hi, how are you?
Hi, Lola. It's great to see you. Your baby must be growing a lot by now.
Hi, Carina. It's nice to see you too. Yeah, my baby's almost 2 months now. I'm so relieved. She's doing very well. My mom's watching her right now, so I was able to come to this appointment.
Oh, good. That's great that you have family and friends to help you with the new baby. I'm glad that she's doing well. How are you feeling?
I'm feeling pretty good. I just had my sugar test yesterday, and it's such a relief that my diabetes test came out negative. No more diabetes.
Oh, that's great.
When I was pregnant, I was really stressed out about checking my sugar levels daily, and when I came in to see Dr. Gonzalez. But this time, I was even more stressed out to find out the results.
I think it's completely normal for you to feel like that. A lot of women who have had gestational diabetes are very nervous to know what's going to happen after their baby is born.
Yes, I was worried. There was so much to think about. When I was pregnant, I had to write down everything I ate. I also had to eat less sugary things, which I love. But then, I did it for my baby, so that helped.
It was a lot of change, but everyone said that you did a great job.
Everyone?
Dr. Gonzalez said that you made it to every single appointment. And the nutritionist said that you made adjustments to healthier food choices. And now you and your baby are healthy.
It was really a family effort. I don't think I could have done it alone. Now I'm so relieved. I don't have to think about diabetes. And now I have my baby.
You should feel proud of yourself and know that you can keep it up. Right now, your test shows that your sugar levels are negative for type 2 diabetes. And you worked so hard with all the determination that you had when you were pregnant. This time, the diabetes did go away, but the risk does not go away. Your risk is higher for getting type 2 diabetes and getting gestational diabetes again if you get pregnant. Keeping good habits is the best way of keeping you and your family healthy. It's recommended that you make an appointment every year to get checked.
Yeah, I just thought life would go back to normal.
Well, perhaps you can tell me, what is normal? What does that look like to you?
Well, now I'm not as worried or afraid about getting diabetes. Now I'm breastfeeding my baby, and I know that it's good for me and my baby. But I'm also thinking, how do I keep up the healthy eating habits?
Good, good. What do you think would make it hard to do that?
Well, I have to go back to work soon. I'll be very busy and very tired. I want to keep eating healthy, but I don't think I could do it.
You made some good changes when you were pregnant. You made those changes for your baby and yourself. If you want to eat healthy, you can do it.
Well, I'm not sure I could do it. I have to think about many things: my work schedule, breastfeeding, finding a new babysitter, meal planning. I don't think I could do it.
Lola, having a baby is so much work, and life is stressful. Remember, I'm here to help you. That's my job.
Thanks, that's helpful.
I can help you. Have you heard of an action plan?
An action plan? What do you mean?
When you start thinking about all the things, it feels like a lot, right? Work, breastfeeding, childcare, healthy eating, too much?
Exactly. I can't do it all.
We can think about one thing at a time. We can take small steps, one day at a time. It's okay to ask for help. We can create an action plan together and work on one important thing at a time.
One day at a time? Well, I think I could do that.
I know that eating healthy can be time-consuming or less easy at times. But if we look to set a goal, or if we create an action plan in the next week or two, that might help. Do you think you can plan on something to do in the next week or two?
Yeah, I could do that. What about eating healthier?
Good. What do you think you could do in the next week or two to keep up with your healthy eating?
Well, I think I could add a vegetable to my meals. Fruits are not so hard. It's the vegetables.
Can you tell me more about that?
I think I could add one vegetable in the next week. I like salad, so maybe I could add a salad to my dinner.
Lola, that's great.
Or I can think of another idea. I have to go back to work in 2 weeks, and I want to think about how do I continue breastfeeding my baby with a new work schedule and a new baby. It might be hard, but I don't want to stop yet.
That sounds like it would help you and your baby.
Oh, I have another idea. I really enjoyed walking in the last months of my pregnancy, but since the baby was born, I really haven't had much time to walk.
Okay.
I want to walk in the mornings like I used to.
These all sound like great ideas. Is there one goal that you can set for the next week?
Ideally, I would do them all, but I could start with one. I really want to focus on breastfeeding for when I go back to work.
That sounds like a great idea for you. Do you want to tell me some of your ideas for your plan?
Yes.
Then can I call you in a week or two to see how you're doing with your plan? What day and time works best for you?
Maybe Wednesday around 4 p.m.?
Good. Now that you're here, I'd like to hear about your plan to continue breastfeeding.
Sure, so this is what I want to do.